a global center of healing with legions of specialist staff, state-of-the-art facilities. Nestled on the west coast of India in the city of Mumbai is one institution that is all this and more. Jaslok Hospital and Research Center. Service, compassion, excellence. Jaslok Hospital and Research Center was set up in 1973. And is presently one of India's oldest tertiary care multi-specialty hospitals. The institution currently has about 35 specialties, and these are growing steadily. High-definition diagnostic and therapeutic imaging have come a long way. Jaslok's MR-guided focused ultrasound surgery unit is the first of its kind in India and Southeast Asia.
We have different subspecialties like ultrasound, CT, MRI, X-rays, DSA, that is digital subtraction angiography, mammography, and our newly added highly advanced revolutionary MR-guided focused ultrasound surgery under single umbrella of radiology in this hospital.
The way I see the future is building of the next generation operating room, replacing traditional surgery by non-invasive outpatient procedure. Insightec was established in January 1999. The company developed a breakthrough technology that in essence allows to treat human beings without cutting the body. We developed technology and systems that are capable to destroy targets deep inside the body, completely non-invasive. The unique part of Insightec is that all this procedure is being done under real-time monitoring and control of treatment outcome. So the user is capable to change treatment parameters on the fly, not in retrospect, and achieve the desired outcome.
The main part of the system is the transducer that transmits the ultrasound waves from this area here. This has 1,000 elements in it. Each one of them is electronically controlled by a complicated electronic system together with mechanics, software that supports it. Each one of those elements are transmitting the ultrasound waves, focusing at the treatment point.
The technology allows us to treat almost any tumor inside the body. We started with uterine fibroids. It's a huge problem. About 25% of the women will suffer from significant symptomatic effects. Today, the gold standard is hysterectomy. Patient is going through hysterectomy, then she will be hospitalized for a couple of days, let's say 3 to 5 at the hospital, sent home, and will recover weeks it'll take to recover. In our treatment, next day the patient is back to her life, work, family, whatever. It's a dramatic change for the women. Step 2 was turning into oncology. We selected a specific application which is metastatic bone tumor. It's a palliative treatment. The next one, which is in many ways the holy grail of this technology, is brain treatments. We are treating central nervous system diseases like Parkinson, like essential tremor. We've seen patients that for tens of years suffered from this disease, leaving the table immediately post-treatment with no tremor. We'll definitely look as a next step on brain tumors, prostate cancer, liver tumors, breast cancer, and so on and so on. Eventually, we see it as a next generation operating room, centralized service in the hospital.
I'm Sandhya Dhuru. My gynecologist advised me to go for sonography Through sonography, she came to know whether I'm having multiple fibroids, which are quite, 2-3 are quite large. So then surgery was not possible. So she was, after every 6 months, she was calling me for this checkup. My gynecologist advised me, if I don't want to go through surgery, then you can go for this focus ultrasound. I'm very happy about this procedure. Instead of operation, this procedure is excellent. There is no mark, no scar, no bleeding, nothing. This procedure is very good. I will suggest people, instead of surgery, they can go for this focus ultrasonography.
My name is Jaykishan Daswani and I am 55 years old. I have a habit every 12 to 18 months I do a regular blood work test, and this year when I did it, I found my free PSA levels high. Desai is the one who actually told me about the advantages of this and gave me a lot of material to read, and they do it under his supervision. He's the head doctor in the MRI section, and apparently he's done a lot of these cases. So it is safe, comparatively a safe procedure, and a risk-free. And the good thing is, because it is non-invasive, you're out in and out of the hospital in a jiffy. Good thing about this, okay, the reason why I chose this is because it almost, not 100%, but it almost guarantees your neurovascular savior, which means all your functions, including the erections and other things, sexual functions, are more or less guaranteed, which are not guaranteed in robotic. And yes, so I am back to normal, and I find this is a very easy method rather than surgery, where the recovery time is higher, and there are a lot of ifs and buts, and unlike this one. A month after the procedure, you're required to do a blood test again. After the procedure, 1 month, my report from the general PSA from 3.1 has come down to 0.75. So that itself talks for the success story. I have to continue monitoring my PSA every 6 months, first 3 months, and then 6 months, and then a year, until 2 years. But from the first test itself, you can see how the PSA has dropped, which means I am free from the cancer cells. Thank you very much.
Hi, I'm Samantha Pillai, 37-year-old. I was suffering from lower back pain. Due to this pain, I was not concentrating on my work, even my office work also. I had consulted orthopedic doctor. He had suggested to meet Dr. Srinivas Desai, and I came to meet Dr. Srinivas Desai. He had suggested me to go for MRGFS for facet joint. And I had spoken regarding this. I had spoken to my family member. They had also advised me to go for this test, and I came for this procedure. It took me only 2.5 hours, and that also without GA. And after the procedure, I went home back, and next day I had joined the duty also. I am very happy that I underwent this procedure, and it's changed my life completely.
From Nigeria, and talking about the problems, I've had 2 open surgeries before, and I had a challenge that probably needed another open surgery, and I know that because of my past experiences with open surgeries, I had said I didn't want to have any more open surgeries, so that's why I'm here.
Okay.
That's actually how I came about knowing all of this.
Okay. So what symptoms do you have? And what were you told with what was wrong with you, basically?
Initially, they were it was diagnosed to be fibroids, and on getting here, we realized they were not fibroids but adenomyosis. And the best treatment that they didn't have anything to do with open surgery was all I was looking out for, and finally I found that out on the internet, and we thought to give it a try. That's what brought us to Jaslok.
How did you find out about MRGFUS in Jaslok Hospital?
We got on and we found it out that a few places in the US, a few places in Europe, and we wanted to find out where a place that is easily located, a place that is easily accessible, that we could get it as soon as we needed it. And at the time we were looking for, we didn't know we were going to have an emergency anyway. That's actually what happened. We thought it was what we would find out and, you know, keep it at the back of our hands, at our hearts, and much later get into it. So we just think it was just God's own way of letting us know that something like that existed. And we just wanted to find out if there was any presence of it in India. And Jaslok Hospital just popped up immediately. And we checked through a bit about the profile of Jaslok Hospital, and were satisfied by what we found.
Okay. How do you compare the treatment that you've had, the MRGFUS, as compared to your previous surgeries, in terms of undergoing the treatment, in terms of recovery time, and in terms of general feeling, basically?
You know, I would say it's like night and day, because for open surgery, it's like your body stops working for a while, and then you don't own your body for a while. What I would say happened here was that I came to the hospital, walked in, went through the machine, a little heat and a little feeling of sore after. I felt a bit sore down there, but that is all that feeling left the same night, and then by the next morning I was myself. Even the same day I walked out of the machine myself. I did everything myself. So I just figured it's like night and day compared to what I've had previously.
Okay. Would you recommend Jaslok Hospital and this treatment to anybody else?
Oh, certainly. Certainly I would. I would, for anybody who does not want, who wants a non-invasive kind of surgery. I think that's the best way to do it. I would have them, I've gotten a good attention in Jaslok Hospital.